Hey everyone, welcome back to the channel. This video series is about my rotations from PA school. I graduated 2 years ago. Still remember a lot of them though. And so this video is going to be about my pediatric rotation and my OB/GYN rotation in one. The reason being is because I actually graduated or did my clinical rotations during the height of the world shutting down. So a lot of OB/GYN clinics were not taking students anymore, obviously out of abundance of caution. And a lot of pediatric clinics were not taking students anymore. So I actually had to do my pediatric clinic and my OB/GYN clinic at family medicine clinics. And I did get to see pediatrics there, and I did get to see mainly gynecology. I wasn't seeing OB, obviously. But I was also seeing a mix of other patients because it's like sometimes you're not going to get a gynecology patient. So I'll start off with my gynecology rotation. So like I said, this was at a family medicine clinic. This was actually a really well-run clinic, really well-established clinic that would have about 3 providers at a time, 2 or 3 providers at a time in clinic. Actually, 2 to 4, depending. And I was with a PA, and this PA had her entire roster of her own patients. She saw them on her own. She basically operated very independently. She had been practicing for about 5 years. She was extremely competent. You can tell that this girl was like that super smart, know-it-all student in PA school. She really kept up to date on the latest research and, you know, had a really high standard of care when it came to her patients. That was something I really admired. Even though personality-wise we didn't get along the best, I very much admired that level of care she took to keep up to date on these conditions, and she was very thorough with her patients, and her patients really loved her, and I think they could tell that this was someone who deeply cared about their health and was investing the time to make sure that she could offer, you know, things, and she was very comfortable with introducing kind of new techniques, new measures, as long as they were evidence-based for her patients. I bring that up to say because there are a lot of family medicine clinics that operate very old school, and sometimes they're run by providers who graduated a very long time and aren't looking into the new data very often, so they're operating by older standards but might not even realize it. So because that's really common, I just really appreciated someone who's just like, hey, well, let's, you know, this is a new thing and we'll do this, and, you know, this medication shows evidence for treating this condition as well, so, you know, let's try that. And she was really good about getting prior authorizations done for her patients, and it was really cool. So how did this rotation go? So it was Monday through Friday. I want to say it started, I want to say it was a 9 to 5. And so we would arrive at 9 o'clock. The PA had a medical assistant who was her dedicated medical assistant. The medical assistant would triage the patient, get vitals, put them in a room, then put a sheet of paper for whatever they were there for. Sometimes it was an acute complaint, they're sick or, you know, in pain or whatever it might be. Sometimes it was a follow-up on maybe previous medication or a previous condition. Sometimes, sorry guys if you hear that, someone's just walking upstairs. Okay. Sometimes it was ER follow-up, someone, you know, when you're supposed to follow up with your primary care after an ER visit, and then sometimes it was new patients. And so she would send me in to go see the patient first. I would obviously get the history, you know, get chief complaints, do my physical exam, and then I would go to the PA. I would present it to her, and I would say what my plan would be, what testing I wanted to do, what my physical exam suggested, what my differential was. She would ask questions. She definitely was someone who was going to drill, and I appreciated that because, I mean, that's how you learn. I also did a lot of the documentation, which I was happy to do. Because I used to be a scribe, so it was in a super high or a super steep learning curve for me. And that's basically how it went. The nice thing about this clinic also is you had your dedicated lunch break, and a lot of times they would have reps, pharmaceutical reps come into the clinic, and it was just really cool because you had the opportunity to speak to these reps who could tell you about these medications that were being used, whether or not they were covered by insurance, what the data says about them, what their indications were, why is this one better than the previous standard of care. And it was really cool because obviously I'm Muslim, and so they would actually bring in halal food specifically. The clinic was owned by 2 Muslim physicians, so it was nice that they just had that level of in this case, it's religious competency, but cultural competency, so that I could actually enjoy the food. Because a lot of times I'd have to stop back and be like, well, I can't have that. It has pork in it. And that would kind of suck. So it was nice. I never really had to make lunch very often because it was almost 3 times a week that the reps would bring in food. And it was always really good food. So that was nice. So that was my... Oh, so gynecology. On top of that, sorry, it almost sounded like a family medicine rotation, didn't it? She did everything. She saw kids, and so she had a lot of gynecology patients. So really, those were the ones she would prioritize me seeing. And a lot of them were just typical, either they were coming in for pelvic exams and pap smears. So I got pretty good at doing pelvic exams and pap smears. I also, if they were coming in with complaints of vaginal discharge and needed to be tested for STDs, or sometimes it was birth control counseling. Sometimes, it was issues with, like, let's say dysmenorrhea or menorrhagia. They're bleeding heavily or they're having really painful periods. You would send them over to get ultrasounds and then kind of evaluate, well, is this someone that we need to refer to an actual specialist for further evaluation because we found a fibroid on the ultrasound, or they have PCOS. She was really, she had a lot of patients, and she was very religious about treating PCOS, which I really appreciated, because a lot of times it feels like, even though we know metformin is a medication that is so helpful for people who have PCOS, so many times it's just not prescribed. And it's like, but PCOS is basically, the end game is diabetes. And it's like, if we can intervene early, you can really give someone an opportunity to mitigate those the chances for developing diabetes, which is a very destructive disease when you think about the risks associated with that. So that was mainly what I can think of I saw gynecology wise. So a lot of pelvic exams, pap smears, birth control counseling, and then dealing with gynecological complaints, vaginal discharge, painful urination, painful periods, things of that sort. So that was gynecology. Pediatric rotation. Let me just take a sip of my water. My pediatric rotation was done at a family medicine clinic as well. I was kind of sad because I didn't get to see as many kids. And a lot of the kids that I did see were sick visits mainly, but I did get a sense of, in the gynecology clinic, because it was family medicine, I did get to see a lot of kids stuff there, so that was kind of nice. But yeah, so pediatrics, I mean, you're talking, infant exams, scheduling, I don't want to say it because I don't want to get it marked down if it thinks I'm talking about a very type of shot, but giving the shot according to the schedule by the organizing body who decides when children get those scheduled shots. What else? What else did I see? A lot of sick visits, a lot of rashes, a lot of runny nose, a lot of diaper rash things, a lot of breastfeeding counseling was given. That was mainly it. I didn't see a tremendous amount of children. At this clinic specifically, there was a high rate of autism in children, and there's a high rate of asthma. And honestly, that was largely due to where it was located. It was located in a very low-income area, and we know that they tend to have higher rates of autism in children and asthma in children, just because of the environmental factors. So that was really kind of discouraging to see, because it just reminds you of the realities of the way socioeconomic status affects health. And it was sad because it's like, we can medicate you, but we know that what's going to help the most is getting the heck out of that city. I was in Detroit. I was just I was in smack dab in the middle of Detroit. So, and not downtown, not midtown, like the actual neighborhoods. And so there was a lot of like violence and drug use, and it was just hard to see patients health being affected by that, you know. So yeah, those were that was my gynecology and pediatric rotation. That's really all I can think about. If you have any questions, just leave them in the comments below. All right, guys. Next, which one should I do next? I'll do my family medicine rotation next. All right, take care.